Let's talk about universal basic incomes and why I think New Zealand should have one. Imagine how your life would feel if you knew that you had enough money to get by every week. No matter what, you will be able to eat this week. An economy only works when money moves. But right now, a lot of money is stuck. Big corporations, property portfolios, overseas profit, it all piles at the top. And trickle-down economics doesn't work. We've seen that. Regular people are just scraping by. And when we, the regular people, don't have money to spend, because we spend it, we don't hoard it, businesses struggle. So a universal basic income would fix this from the bottom up. When people have a little bit of spending money, they spend it locally on food, power, school fees, on the dairy down the road, and then that boosts businesses, which then creates jobs, which then brings back in money through tax. And that's how economics should work when it's not jammed up. A universal basic income would give us something we don't actually talk about much, freedom. And not sit on the couch freedom, but options. It lets someone leave an unsafe relationship. It would help a new parent stay home for a few months. It would let a young person try something new, like start a business without completely falling off and flopping their life. It would value unpaid work like emotional labor at home, and it would make care work visible. It would give people space to just rest and recover. And I don't think that's lazy, I think that's humane, and I think New Zealand leads a little bit more humanity. Now, obviously, how do we afford this without borrowing, right? Because that's what everyone will always ask. Well, we do already fund a basic income, and it's called the New Zealand superannuation, and it works, and it's worked for a really long time. We already spend billions of money on tax breaks for landlords, so it's not really about whether or not we can afford it, it's about whether or not we prioritise it. A lot of people say the government will never get that money back, and you know what? That's true. They won't. But this is the thing, they're not supposed to. A government isn't a business. It doesn't need to make back every dollar that it spends. We spend billions funding public education, but we don't sit there going, hang on, did we earn any of that money back yet? No, because we understand that schools are creating long-term value, better jobs, safer communities, workers, and that leads to a strong economy, so it's worth the investment, right? Same with hospitals, libraries, fire services. They're infrastructure. They make the system work better. So a universal basic income would be that same kind of investment. We're not going to get every dollar back, but what you get back won't be money. It'll be happiness. It'll be happy citizens thriving and spending money in an economy that works, that actually functions like an economy. And then obviously some of it would come back in tax. But even better, you just build a nice society where like people aren't freaking scared to like not be able to eat every week. So no, a UBI wouldn't pay for itself in like a strict traditional sense, but it would pay us back in a different kind of currency. Stability, dignity, resilience, opportunity, and humanity. We're also entering a world where AI is going to change it. Jobs will disappear. Others will shrink. We do not know what work will look like in 10 years, and we know that the concept of work can change in a minute, as we saw with COVID. We do know it's going to be more unstable and more automated. They're already starting those things. So a universal basic income would give us that safety net before that all starts to happen. So it'd be a way for us to adapt to a new AI world and at least be able to afford our food. One more thing. If you give a billionaire $500, they're probably going to put it in their bank account because they're a billionaire, and they're a billionaire because they don't spend their money. They'll put it in their bank account offshore probably as well, like an Australian bank account. But if you gave a working class person $500 right now, where do you think they'd spend it? Probably in their community, right? But right now, so much wealth is stuck at the top in trusts and stocks and property and offshore accounts that it doesn't circulate. So a UBI would keep our economy actually moving. Feel free to critique kindly so that we can always better this argument. But yeah, I think we need a UBI before the robots arrive.
Oh, cool. Your company gave you a raise between 2 to 5% this past year. That's not a raise. That is a cost of living adjustment. That is not even meeting inflation. We need to change the rhetoric here. We need to stop thinking that that is a raise and understand that a raise is actually about merit and performance and should actually make an impact, a substantial impact in your life because you deserve it. I just talk to so many people in my network all the time who are getting these raises, and it just feels like they're being gaslit. Like, that is not a raise. That is simply an adjustment in your salary that, quite frankly, barely makes a difference. And unfortunately, the fact that this is happening consistently, like, this is why people jump companies and change. Like, you don't actually get these significant bumps anymore unless you get a massive promotion, or you move to a different company, or you are fortunate enough to work for one of the few companies that actually understands that paying and treating your employees like they deserve is actually what keeps them.
This is a friendly reminder that if you've got a regular 9 to 5 and you're able to pay your bills, you are doing a fantastic job. Don't get caught up trying to impress people or live the life that you see on social media. Be proud of the job you have and that you're able to take care of yourself.
Even though I'm not in Philly right now, of course, I stand with the workers that are on strike. I think what really upsets me is the fact that these people aren't asking for much. Like, they're genuinely asking for a livable wage. And I think I read that on average, they're making between like $40,000 to $46,000 a year. And I think about the fact that I was bitching and moaning when I had my first job out of college and I made $41,000 a year. And I was working at a desk in a nice air conditioning office using a computer. These people are literally getting up every day. They're taking out the trash in the city in conditions like the summer when it is sometimes upwards of 100 degrees. And rather than give them a slight raise, the people that run our city, they are giving themselves a raise. Yep, we know that. And would rather let the city on 4th of July weekend just get flooded with trash. So yeah, disappointing to say the least. But I stand with the workers. I hope they keep striking until they get the pay that they deserve.
Livable wages shouldn't be a perk. They should be the bare minimum. Because the truth is, when people can't afford to live, they eventually stop showing up. That's why you're seeing strikes. That's why turnover is insane. That's why whole industries are short-staffed. People are burned out, underpaid, and done. So yeah, livable wages, they're not just necessary in 2025. They're overdue.
So to everyone who saw my I Hate Nursing video, and if you didn't, hi, I'm Margaret and I hate being a nurse. I just wanted to come on here and let you guys know that I have officially put in my resignation and quit my job. I honestly couldn't be more happy. I am going to be transitioning into clinical research, and honestly, if this does not work out, it sounds like it's going to be a pretty cool opportunity, but if this doesn't work out, I'm done with nursing. This is my last chance, and honestly, a lot of your comments are kind of what got me here and gave me the confidence and like push to really change my life. So I just want to thank everybody who came on here and supported me and validated my feelings, and I just want to send you guys all my love, and I'll keep you guys posted.
Hey everyone, quick update you need to hear. San Diego-based Sharp Healthcare just announced that they're laying off 315 employees, which is about 1.5% of their workforce. This includes senior executives and roles in medical information and marketing. So what's driving these cuts? According to Sharp, the rising cost of healthcare is outpacing revenue. They are also facing state-mandated seismic upgrades and poor reimbursement rates from payers. So bottom line, they say they can't keep up with the economics. Here's what else is changing. Some staff will see reduced hours and others will be moved into adjusted roles. Sharp says the majority of cuts are in non-clinical areas, so direct patient care won't take much of a hit. Leadership is also fearing the squeeze. Senior execs are taking a 15% pay cut, and the CEO, Chris Howard, is trimming another 10% off of his own salary. So now Sharp is offering severance, extended health care, and career transition support for those impacted, which is better than what some other systems that I've reported have offered. But still, this is a signal that no health system is immune, especially if you're in a non-clinical or even in an administrative role. If you're a nurse or allied health professional thinking your job is secure just because you're not at the bedside, this is your warning shot. So let me know, definitely in the comments, are you seeing cuts at your facility too? And if you're in a non-clinical role, are you making moves to protect your career?
been hearing how much you guys make, and it's not enough.
Nurses are not making it like that.
Indiana and Iowa, the nursing pay is not very good.
No nurse that's working full-time should be making less than $100,000 a year.
100 hours is how much I worked in the last 2 weeks as a registered nurse.
Gross pay of $5,041.92.
Tax. $1,261.75.
I just have to know, how are you Southern nurses like surviving or doing it, I guess? What is the cost of living? Because I've been hearing how much you guys make, and it's not enough. Like, starting in Minnesota, I made more as a new grad than some nurses make who've been doing it for 5 years plus in the South. And I really don't know if the cost of living is just so low that they can afford to pay you that little, or if it's just something in the South where they don't value nurses like they should. Because I promise you, I was a new grad, started in, med surg, and my base pay was $32 an hour. And now I've been a nurse for about 4 years, and that has gone up significantly compared to when I started and compared to a lot of other nurses I hear in different areas. And I'm not saying that as a knock on nurses at all. It always starts with the CEOs and the hospital CEOs, and union versus non-union. Nurses need to get paid what they're worth, and I think it should be equivalent across the board, and it should be at least $50 an hour and higher. Base pay starting for a nurse, especially if you're bedside and you're working in critical care, ER, med surg, any specialty in the hospital, you need to be making that or higher.
I'm a new grad critical care nurse, and I want to go over what I made in the last 2 weeks. Nursing earning potential really does depend on where you live in the country. I did pick up a shift on this paycheck, so this looks a little bit different than my control hour paycheck. The last 2 weeks, I worked 76 hours, and I had a gross pay of $5,041.92. Out of that, I was taxed $1,355.55, and that's why I don't look at my pay stubs. My base pay is $41.16. My overtime rate is $67.29. I have a weekend premium of an additional $4.50 an hour. My evening and night shift premium differential is a total of $2.35 an hour. I also make an additional $2 an hour because I work in critical care. On this paycheck, I contributed $403.35 to my 401k, and then I had to pay my vision, dental, and my normal health insurance, which looks like it totaled around $100. Overall, my take home for the last 2 weeks was $3,122.39. I am a New England nurse, in case anyone was wondering.
I finally get paid tomorrow, guys. This is my first ever paycheck as a nurse. I live in New York City, so I'm going to do a quick breakdown for you guys. I got to see my pay stub, so this is for a total of 75 hours. This is a bi-weekly check. I am on orientation, so there's no overtime or difference or anything like that on this pay. It's just my base pay, and I am working Monday through Friday right now. Okay, so my gross pay was $4,077.30. Tax, $1,261.75. So that leaves me with a take-home pay of $2,815.55. I already knew they were going to tax the out of my check, but to actually see it, it's just like, damn. However, I'm still very grateful to be a nurse, and I'm grateful to be able to get a bigger paycheck. So that is what my paycheck looks like as a New York City nurse.
It's payday, so let's go over my paycheck together. Hey guys, I'm Casey, and I'm a new grad cardiac ICU nurse, and let's talk about pay transparency, where I'm gonna share my paycheck with you. This paycheck has 3 overtime shifts on it. 1 week I worked 1 overtime shift, and then the next week I worked 2 overtime shifts. So as a new grad cardiac ICU nurse, I do make $28.35 an hour. This is the same rate that every single new grad in my hospital is paid. Now, pay depends on where you're located. I am currently located in Missouri, where I personally believe that nurses are not fairly compensated. So that's a story for a different video. But in my hospital, on top of federally mandated time and a half, we currently do have an overtime incentive. So for 35 hours, I was paid an additional $20 an hour. And then for 3 hours, I was paid an additional $30 an hour on top of my federally mandated time and a half. So this paycheck is very nice, along with I do work a special shift at my hospital where I work weekend program. I sign a contract that says I will work every Friday, Saturday, Sunday, and I work weekend nights. So because of that, I earn an extra $12 an hour on top of these amazing incentives. So Pre-tax, my paycheck was $5,434.76. Like I said, that's me working night shift, weekend program, incentives for overtimes, and 3 overtime shifts in one paycheck. My pre-tax deductions, those are things like my retirement, and I had to pay for parking this paycheck. Those were $452. My parking was only $18. So we put $434 to retirement. My after-tax deductions, this is my health insurance. I paid $32.50. And then taxes. Good old Uncle Sam took $1,436.21, meaning that my take-home pay for this paycheck was $3,513.27 as a new grad cardiac ICU nurse.
Let's talk about the time that I was fired after one weekend call out. So I was at this facility for about 3.5 months. This was a while back. And prior to that one weekend call out, I had only called out once at that facility. So I was not a frequent flyer when it came to call outs. Mind you, I had also picked up a lot of extra shifts at this facility. Whenever they had a hole in the schedule and they would ask me to pick up, I would pick up. But there was one Sunday night, and I had worked the 2 previous nights prior to that. And the ratios at this facility were very unsafe ratios. And I was just extremely burnt out. I did not get much sleep because I was working 16s and 12s at this facility. And at that point, I just needed to call out. I just did not think it was safe for me to come to work with that lack of sleep and burnout. So the ADO1 was on call, and I called and told her that, yeah, I need to call out tonight. She told me, you just can't call out because you're tired. If you call out tonight, you will be terminated. And needless to say, I was surprised that she said that because I was always there to help this facility whenever they needed coverage on the floor. But the one time I felt like I genuinely needed to call out, I got threatened with termination. So when she said that to me, I was like, okay, that's fine. You want to fire me when I've helped you and picked up extra shifts for you? That's fine. And like I said, I had only called out one time prior to that. So she fired me. And honestly, I hope that someday if she's ever in a situation where she needs to call off work, I hope that her superior has more grace on her than she did with me. Just kidding. I hope she gets fired.
I just got fired. Yep, you heard me right. I just got fired from the job that I've worked at off and on since 2016. I guess they're mad and got word that I had a TikTok account. The administrator just called me and said that basically she got word, this was her words verbatim, hi, this is blank, the administrator. And I was like, yeah. And she was like, we got word that you have a TikTok account and you've been filming here in the building and saying some not so nice things about our building. She was like, and you signed an agreement on TikTok that you wouldn't film at your workplace. And I said, oh, did I? I don't think so. But anyways, it's beside the point. And I was like, okay, well, I won't make no more nurse videos. You know what I'm saying? Like, I won't make videos while I'm working. And she was like, unfortunately, she was like, we have to terminate you. She was like, this calls for termination. And I was like, oh, okay, bye. Like, literally, like, okay, what am I supposed to say? Like, okay, I'm a nurse, I can go anywhere. And for all the haters that were on here and inboxing me and saying I shouldn't be filming at work and, you know, saying all this and that, do you know that I am not the only nurse that films at work? There is hundreds of accounts, and I'm not going to name them, but you guys, I'm sure if you follow me, you see other nursing content. It's good. On to the next. That's all. Bye.
I hope people are paying attention to all of these healthcare worker layoffs happening. Nurse practitioners, nurses, physicians, advanced practice providers being laid off, nurses being laid off, patient care techs being laid off, respiratory, PT, OT, speech. Max, calm down, buddy. What's going on there? Just relax. Primary care offices closing, labor and delivery units closing, entire hospitals closing, urgent cares, emergency rooms, rural access facilities closing. And ask yourself how that could be happening during a respiratory surge. Also knowing how short-staffed facilities already are. Personnel are a cost. Frontline personnel are an expensive cost. Frontline personnel are expensive, and they're expensive to keep. Brand new personnel are a lot less expensive than experienced personnel. They're less expensive to turn over, to temporarily replace. Think about why that's happening. Think about why that is. Considering the immense need for healthcare in this country. Consider whether or not you, your loved ones, your family members, your friends have needed healthcare, primary care, specialists, healthcare facilities, urgent cares, hospitals. Consider how often, how frequently you or your loved ones have needed care as of late. How difficult it was to wait, right? seeing how understaffed healthcare facilities already are, and think about why they would be doing mass layoffs. Do you think it's because they don't need the staff? Or do you think it's because of corporate greed?
Let's talk about what just happened at UC San Diego Health and why every healthcare worker in America should be paying attention. This past Monday, UCSD Health announced it's laying off about 230 team members, roughly 1.5% of its workforce. The reason? They say it's financial pressure, rising costs, federal uncertainty, and reimbursement rates from Medicare, Medicaid, and insurers that don't match the actual cost of care. So let's break that down. Hospitals are operating on thin margins. When the cost of labor, supplies, and compliance goes up, but reimbursement from government programs and private insurance stays flat, cuts happen. And unfortunately, that means people lose their jobs. To be clear, UCSD says these team members will receive their university benefits and some career support. But here's what they didn't say: which departments are affected, how this will impact patient care, or how this fits into the bigger picture of a national trend of medical staff reductions. This isn't just a bad news day for one city, it's a signal of deeper systemic issues. Nurses, clinicians, support staff, we're being squeezed out while burnout rises and staffing ratios worsen. If you work in healthcare, you need to be asking, is your job protected in this economy? What does your contract say about layoffs or redeployment? And how are we advocating at the policy level for better reimbursement and safe staffing mandates? Healthcare isn't just a service, it's a system. And when we cut from the system, we all feel it. So let me know what's happening in your hospital. Are layoffs hitting your team too? Let's make this as visible as possible.